Our proposed impact and outcomes of this project will be improved relationships between the sectors, all of us that work with young people but work across different sectors, and will result in improved sexual health and wellbeing outcomes for those young people. And I think that this project has the potential to be replicated in other regions throughout Victoria. We've heard a bit about the condom vending machines. Just to let you know, here locally we now have signed MOUs with 4 local councils, and this project just aims to provide 24/7 access to condoms for young people via vending machines, and hopefully in a publicly accessible but quite a private place, so sometimes in the toilets of sporting clubs or the toilets of local public parks. And particularly we've tried to negotiate with councils to have these condom vending machines placed in towns where perhaps there isn't any access after hours. One of the other parts of this project is that CERSH is meeting with key workers in each of these shires to invite young people to participate in visual arts-based type projects that will promote condom availability and safer sexual relationships in those small country towns. Each of the communities are developing different approaches, and our role at CERSH will be to provide some of the planning and evaluation support to those groups. And we hope to document the different ranges of those approaches so that other people in the state can learn from them or perhaps adapt them to their own communities. Again, we've just heard about the networks. So the networks facilitate professional development. They encourage debate and discussion, often lively and loud, and the sharing of promising practice. They encourage cross-service linkages and service integration, and they promote coordinated health promotion and clinical efforts that maximise the utilisation of the resources that we have. So the Goulburn Valley and North East Network has been meeting since 2010. We get somewhere between 20 and 50 workers who attend regularly. The meetings happen 4 times a year, usually in Benalla. And workers come from clinical, health promotion, education, youth and other related fields. And just to give you a bit of a sense of the types of topics that are covered by the network participants decide what topics will be covered and what professional development they would like. So the last 4 were looking at professional development opportunities and nurse-led models of service delivery, responding to sexual assault in the context of sexual and reproductive health, female genital mutilation and cutting in regional Victoria, and there were some researchers who gave some feedback from data they'd collected, and the exploring sustainable models for the delivery of termination of pregnancy services in rural Victoria. Again, as just mentioned in Loddon Mallee, we surveyed in excess of 80 workers and asked them how they saw that networks could be established here in the Loddon Mallee, whether we leverage existing networks or whether we create new ones, and I think we did a bit of both. And 2 new networks have been formed through the enthusiasm and commitment of professionals in this region, and we're calling them at this point, they may change, the names may change, the Central Victorian Network, which will meet in Bendigo and complement the Sexual Health Task Group, and the Southern Mallee Network, which will meet alternatively in Swan Hill and Robin Vale. Both have had their first meetings and both were very well attended, which was terrific. And CERSH will facilitate 2 meetings each year for both of those networks, so a total of 4 in this region, and we will also hopefully provide some professional development. Now, I think a good demonstration of how well we all work together is the outcomes for, this was an outcome from the North East Victoria Network, and it was about creating abortion services within the existing service system and not requiring extra resources to be put in. It was around people just coming together and tweaking the way the service system works in order to create new opportunities and new services. So we all know that rural communities have poor access to local termination of pregnancy services and support services. That network meeting that was entitled Exploring Sustainable Models for the Delivery of Termination Services in Our Rural Region attracted 55 colleagues and interested people to the meeting. People commented that it was the first time that we'd seen directors of obstetrics and gynaecologies and directors of big, large health services chatting to youth workers on the ground, people who work in CARSs and other school nurses and other clinicians, GPs and so on. So from that meeting came universal support for CERSH to coordinate towards service improvements within that part of the region. And we formed partnerships with 3 of our statewide service colleagues, those being the Royal Women's Hospital, the Fertility Control Clinic and Family Planning Victoria. And between the 4 of us, we created locally based training for health practitioners and for health and community workers, and ran full-day seminars for local rural workers to build their confidence and build their capability. GPs and nurses were facilitated in gaining accreditation for delivery of medication termination by Dr. Patty Moore, and she really led from the front from the Royal Women's Hospital. We've now got a small number of GP clinics and community health centres around our region who have established their local medication termination of pregnancy service. And we've also demonstrated, and I think this is a real win, that we've demonstrated that MTOP can be low cost to the patient. We've created some of these services fully bulk billed, and the total cost to the patient has been $35 for them to be able to have a medication termination of pregnancy in their own local setting, which I think is terrific. And that's an absolute reflection of the work of the CERSH team. So very quickly, working with Aboriginal sexual health promotion, CERSH ran recently. Previously, we ran a project called the Smart and Deadly Project in partnership with VATCHO and the Albury-Wodonga Aboriginal Health Service. And more recently, we've run a qualitative evaluation of the Smart and Deadly project, and that's now completed, that evaluation, and it's been submitted to peer-reviewed journal for publication. While Smart and Deadly, the project itself, has finished, we've managed to establish some continuing collaborations have arisen from that project. And as you've heard, there's a project called Yarn Soon, Yarn Often, which is led by VATCHO in partnership with Aboriginal communities, both from this region and from the Hume region, and CERSH. And that project is to create a resource that will support parents and significant elders in the lives of young Aboriginal people to start the discussion around sexual health, respectful relationships and STI screening and so on. So that will be completed this year and will be distributed throughout Victoria and beyond, and will be available on the CERSH website. In the next 12 months here in Loddon Mallee, CERSH will support the work of the sexual health component of what Andrew's just described as the Working Together for Health initiative, which has been funded by the department. So in collaboration, we'll determine how to systematically use our CERSH resources and expertise to contribute to the sexual health prevention and early detection effort, and we will ensure that this is comprehensive, coordinated and effective. One of the other things that we like to do is invest in rural workforce, and we've created a series of 3 seminars. It's three parts to 3 seminars, which is around building the confidence and capacity of rural workforces to provide rigorous and defendable evaluation of their health promotion initiatives. So the first seminar starts with broad history and theory of sexual health promotion, and I think importantly this uses sexual health promotion projects that are actually happening on the ground or previously to highlight the key messages in this seminar. And then in Seminar 2 and 3, we use an analytical matrix for detailing things such as the National Sexual and Reproductive Health Strategic Priorities, the Victorian Health Plan target areas, target populations and communities or groups, community engagement approaches, the Ottawa Charter, sexual health determinants, sexual health equity issues, and theoretical underpinnings of particular programs or projects to demonstrate and to build the capacity of our rural workforce to be able to replicate that work. And finally, some of the online learning modules that we're partnering with the Australian College of Rural and Remote Medicine and also the New South Wales STI program unit to create online learning modules specifically targeting rural doctors and GPs. And they usually have, these modules have about 8 components. In the one that's almost complete, we've looked at background into rural health, explaining to doctors perhaps who have worked previously in the city and are coming to rural communities, what are the issues and what are the differences between working in the city and working in the country from a sexual health perspective, issues of privacy and confidentiality in small rural towns, access and youth and minors and building trust with them in your local small community. We focus on the costs, Medicare issues and some of the gaps for payments, pharmaceutical access, which has already been mentioned, contact tracing in a small town, do we have to think about it a little differently when everybody knows everybody, and sexuality assumptions, given that often people from diverse communities are well hidden in small rural towns. So each of the modules contain information. We've filmed and created the modules as learning packages. Sometimes there's a case study or a PowerPoint, and the medical practitioner has to work their way through it and answer questions and create and complete a quiz before and at the end. Each of the modules attract professional development points from the respective colleges, both accredited with the Royal Australian College of General Practice and with ACRM, so that the doctors can gain their professional development points. And we're working towards ensuring that these modules also align with nursing and other allied health professional development requirements, so that those people can do them as well. The online modules are accessible to doctors through the ACRM website and will be available through the Royal Australian College of General Practice. But more importantly, we've negotiated a contract with ACRM that will allow these modules to go onto the CERSH website, so that they will be publicly available to all rural practitioners if you're interested, and you can do components each one by one if you want to, or you can do the entire 8 if you've got a couple of hours to spare. So hopefully they'll be of help to people who are working in rural communities and help to highlight some of those specific issues around sexual health clinical care.